Okay, it is 10 o'clock, so let's get started. Good morning. Welcome to the January 27th Public Health Media Briefing. We have Dr. K with an update. We'll hear from Liz Gomez on testing, Rachel Allen with regards to vaccinations, and Jamie White will talk about masks. And then we will open it up to the media for questions. With that, I will hand it over to Dr. Kasiri.
Good morning, everyone, and thank you for joining us. So a brief update on the numbers. We are at 250,811 cases of COVID-19 reported to Sacramento County. We are averaging about 2,500 cases per day, and our current case rate is at 161.2. This is data from yesterday, and this is per 100,000. So there's definitely been a decline. If you recall, last week, the number was 190 per 100,000. So we are seeing a decline in the number of new cases. The deaths are 2,646, and we're averaging about 4 to 5 new deaths being confirmed every day. Two areas of concern. One is with the hospitals, where we're still seeing an increase in numbers. And the last report we have is 629 in the hospital, including 98 in the intensive care unit. And then the jail outbreak, the last report we have is 135 in the main jail and 146 in RCCC. I will turn it over to Liz for the testing update.
Thank you. We are starting to see a level off on testing numbers. We did about 13,500 tests at our community sites last week, and we're already seeing decreases from that for this week. Most of our sites are meeting a consistent 30-minute or less wait time. All 13 of our sites are open and available for the public, with most offering both PCR and antigen tests. In addition, we've seen better turnaround times with the state's Valencia laboratory for the PCR tests. So don't hesitate to come and use the community resources that are available.
Hi, good morning. I have a brief immunization update. Late last week, the CDC released 3 new studies that looked specifically at vaccine protection against the Omicron variant. All 3 studies offered evidence that protection against COVID-19 is highest for those people that are up to date with their vaccination series, and that does include getting boosted when eligible. The data revealed that the booster dose is 90% effective at keeping people out of the hospital after infection and 82% effective at preventing emergency department and urgent care visits. And as Dr. Kasiri mentioned, that is a significant concern for our community as our hospitals are being impacted by the Omicron surge. This recommendation to get boosted isn't different than other vaccine series that we start in childhood or even adulthood. It's always important to be as up to date as you can be, including boosted. So again, encouraging folks, if it's been 5 months since you completed your Pfizer or Moderna series, it's time for you to get that booster shot. If you received a J&J, you can get boosted after 2 months. And in that case, it is recommended that you get an mRNA vaccine as the booster. So please take a look at your CDC card. If it's been 5 months since that second dose, I would urge people to go out and try to make an appointment and get boosted today. It's also noteworthy to mention that still many of our Sacramento community members have yet to receive their first or second dose of the COVID-19 vaccine. We do know that the unvaccinated are at a significantly higher risk for infection and severe disease from COVID-19. And I do want to highlight specifically children ages 5 to 11. This is the population that most recently became eligible, and they're lagging behind in vaccination rates. The state revealed that 3 out of 4 children in California that are in this age group have yet to even receive 1 dose of COVID-19 vaccine, leaving them vulnerable at a time when Omicron is surging. If you have questions about vaccinating your child, we really encourage folks to reach out to their trusted medical provider to get some of those questions answered, to be reassured that this is a safe and effective vaccine for children. Public Health and many of our COVID vaccine partners are offering vaccine appointments 7 days a week, including pop-ups in a variety of locations throughout the community. There's vaccine in many provider offices, urgent care sites, as well as pharmacies. And so encouraging folks to please visit our website for an up-to-date list of clinics throughout the county, or go to My Turn and book an appointment, and do not delay. Encourage you, if you're due for that dose, to do that today. And I'll turn it over to Jamie White.
Hi, good morning.
So the county participates in a program with the state to obtain personal protective equipment, including N95 masks, to be provided to healthcare facilities in a limited 30-day supply capacity. There is no plan or authorization currently to distribute those resources to the general public through counties. The last distribution that the state coordinated with counties to that effect was in 2020 for cloth masks, and those were directed towards businesses and schools. Any mask is better than no mask. There is additional protection with better quality masks, especially if used appropriately and properly fitted. Individuals should make their own risk assessment depending on the size and setting of venues they'll be attending and their own personal underlying risks. Employers can find additional occupational guidance for occupation-specific sectors from Cal OSHA on Cal OSHA's website.
Thank you for the update. We will now open it up to questions from the media. As always, please raise your hand and I will call on you. Daniel, go ahead.
Hi. So I just heard what you said, Jamie White, about the N95 masks. We have heard that more chambers of commerce have simply called Cal OES and received thousands of KN95 masks. And it's our understanding from Cal OES that counties can do the same, perhaps by working with partners like chambers of commerce. And last week, Dr. Casirier did mention that the county was looking for opportunities to find masks to give out to the public. So my question is, since the meeting last week, has the county called Cal OES about this?
Daniel, we've answered that question several times regarding masks. As Jamie White has already told you, the way that the county orders supplies and gets supplies from Cal OES, there's very specific guidelines on how we do that. I read the story that you guys put out. It sounds like every county told you the same thing, that there is not a mechanism through channels that public health or our MOAC are able to order supplies for the general public from Cal OES. Simone,
yesterday, just to follow up. Last night, we reported on the city of Rancho Cordova working with their Chamber of Commerce, provided thousands of KN95 masks. You guys have a network, right, of partners. Is there? I'm just understanding why, you're not trying to make this effort.
I can respond to that.
Okay.
I think you do need to realize that there are several sources of and ways that different entities can get masks. As far as with Cal OES, there are specific guidance that is provided to counties into how they can receive masks and which populations they can give those masks to. The current guidance that we have from Cal OES states that the masks that we can request are specifically for healthcare settings. The Cal OES may have additional masks available from different sources that they might make available to different entities, such as you mentioned with Rancho Cordova. I think what you would need to do is ask them the sources of that and why they have not been able to make that available to the counties. We have put in a request to Cal OES to verify and clarify their guidance. And as you've heard, every single county has told you the same thing, that we do not at this time have any way of getting masks that we can distribute to the general public. If we had, we definitely would have been willing to do that.
Simone, go ahead.
Hi, I just have like a general question about the mask. So do you have any plans about the K95 mask distribution in like Sacramento County? Knowing like how to get it, where to get it, when to get it, etc.
We know that the schools are getting some through the Office of Education. The KN95s are also available in pharmacies, but we do not have an exhaustive list of places where individuals can get them. Some people are ordering them off of Amazon.
Okay, and one more question. How are we on the Omicron wave? Are we on the good side or the bad side? Do we have any updates in terms of the Omicron variant?
Our numbers are declining. As I mentioned, from last Friday, our case rate was at 199, and it has dropped to 161 as of yesterday. And we're also hearing from the state that these are the current trends that they're seeing throughout the state. We do have to point out, though, that the hospitalizations are still going up, so that is still an area of concern.
Mike with SACB, go ahead.
Hi, this is Mike. I was wondering if Dr. Kasuya could give any insight as to whether the local health order regarding public meetings being held virtually will be extended beyond, I think it's February 1st was when it was going to go through at least, which is next Tuesday.
We are carefully monitoring the numbers, and hopefully that the numbers will continue going in the right direction. I think that February 1st will be too soon, but our hope is that by mid-February, we'll be able to end that specific health order.
Simone, do you have another question, or is your hand still raised from your previous question?
Sorry about that. I'll go ahead and raise it. I'll go ahead and lower it down. Thank you.
Any other questions? Daniel, go ahead.
A different topic about the outbreak in the jails. Were those new or current cases that were mentioned at the beginning of the briefing, and sort of what else is being done? Because I think last week, at least one of the jails, the cases had gone down, and now it looks like they've shot up again. Is that correct?
Sorry, the numbers I quoted to you are current cases. So as you can imagine, they're doing testing daily. And so if they do identify additional positives, they will be added to that number. We are working closely with the jail staff in terms of providing advice and making sure that they're able to quickly test and isolate people that test positive, and also being able to provide at least limited supplies of the therapeutics that we have allocated to us.
Caitlin Stark, go ahead.
Hi, Caitlin Stark with Fox 40. I have a question on that as well. Do you get numbers from jail staff on their COVID numbers? It is not accessible online from what I can find, but is that reported to the county on a daily or weekly basis?
We would only get those numbers if we request them. We do get reports of all positives, and when we are doing our contact investigation, one of the things we ask about is employment. So sometimes that is the way that we are notified about the cases, but yes, we can request it.
Is that something that's been requested recently as we've seen these outbreaks, or
Yes.
something that the county is interested in? Is that something that the media can get access to in terms of numbers, or is there something preventing
Caitlin,
the number release?
Caitlin, if you have questions specific to sheriff staff, you need to go through the sheriff's office to get those numbers. I believe we've previously reported out correctional health staff percentages, but specifically for sheriff staff, you'll need to inquire with the sheriff's department.
Thank you.
And I'll also add that we have, a general rule of thumb for our privacy procedures is we're not going to report out numbers that are less than 5. So if it doesn't reach a certain threshold, we won't release it due to privacy concerns.
Mike, do you have another question?
I do.
Go for it.
So on the topic of vaccinations, a few days ago, the Supreme Court blocked federal OSHA's vaccine or test requirement for businesses with more than 100 employees. So I know this gets asked periodically, but I just wanted to ask with that in mind, does that affect the local strategy in any way as far as boosting our vaccination rates or our COVID response in general, especially with I guess it's kind of separately, but the child vaccination rates that Rachel mentioned were about 3/4 statewide are not vaccinated. Is there any local push to specifically to get those numbers up?
Definitely, we continue with our message to the public about vaccination and continue to look for opportunities to provide that vaccine, working with CBOs, working with schools, and so that will continue.
Could you give any insight as to where we are as far as demand? Are people still getting? Is there a slow but steady pace of first vaccinations, or is it tapered off quite a bit?
I will ask our team. I don't know if Megan or Hannah have those numbers available.
Morning, everyone. Yes, we are still seeing a number of first and second doses, and so it's still around 40% that we're seeing within each clinic. Each clinic has a different variety of numbers, anywhere from we'll see 30 people to 250 people, but it's still around 40% first and second doses.
And so 40% first and second, meaning 60% are boosters. Okay, thank you.
Any additional questions from the media? Okay, with that, we will conclude today's public health briefing. Unfortunately, our Spanish speaker has moved on to other opportunities, so we will not be having a Spanish briefing after this. As always, I will send the recording out this afternoon. Thank you all for joining us.